Hi, my name's Alison, and I just want to thank you for taking a look at my poster, Voices from Browning, an Oral History of COVID-19. This was part of the RUAP Medical Humanities track for the summer of 2021. Just to give some background about where I was at, I was in Browning, Montana, which is the largest community on the Blackfoot Indian Reservation. It's about 1,000 people, and it's really the cultural and economic center of the reservation. In terms of the project itself, that was in conjunction with the National Humanities Center. We underwent training via Zoom with other students participating in this project. The goal being to collect and curate an oral history of COVID-19 from the perspective of non-physician frontline workers. So I was able to recruit from word of mouth and getting to know people at the Blackfeet Community Hospital, 5 people who agreed to participate in these interviews. The interviews were collected in audio only recordings. I offered the opportunity to participate in a video recording, but everyone preferred audio. And these interviews lasted from about 20 to 50 minutes. And afterwards, I took a look at the themes that emerged from these, and I think that most notably, and perhaps not surprisingly, all of the participants indicated that they, at some point working during the pandemic, that they were afraid for the safety of their family and also for their personal illness. And then one thing that came up that was a little more positive was that everybody noted that mutual support from coworkers was something that helped them get through the pandemic. And in some ways, the experience of working during such a healthcare crisis really drew them closer to their coworkers. I also asked everybody why they agreed to be interviewed, and I was surprised to see that anger towards the administrative response came up a couple times, and then also a desire to participate in the historical record. Many participants felt like it ought to be recorded, and they hope that they can use this information in the future to adapt and respond perhaps in a better way to not only the COVID-19 pandemic, but other kinds of emergency situations in healthcare. In terms of what this project means in the larger context, I think that a lot of the participants expressed a gratitude also to be able to participate in oral history, and from my experience, it did provide a deeply personal and vivid record of shared moments in healthcare. And it also allowed for the interviewee to reflect on their personal experiences, and also for me as the interviewer to practice empathy and an emotional connection. I think practicing collecting oral history, especially in the healthcare setting, gives a space for reflection that we often don't give ourselves. It also improved the understanding of Browning's response to COVID-19 and some of the challenges it faced, in terms of major successes. 96% of the community is fully vaccinated as of July of 2021, and they were able to share some of their vaccine supply with surrounding communities in a safe way. So the community really came together for that. In terms of other practical uses for the data, besides those exhibits and documentaries and just the National Archive and preservation that the National Humanities Center will do with these interviews collected, I think this could provide an opportunity to find some data, or at least anecdotal data about areas for improvement in emergency responses from healthcare administrations. That was something that a few of my interviewees brought up, and some of them even asked, where is this going? I would love for this to go to the administration. I want to share my perspective on how I feel like this could be improved. And more broadly, these interviews, not only just my 5, but, in conjunction with everybody else's RUAP experience, can really create a living document of the COVID-19 experience. And for Browning in particular, there was a great appreciation. Everybody I told about this project was really excited because they told me that oral history was such an important part of their community and their longstanding traditions. And they were glad that in such a dark time, they were able to continue this and help the medical community at large.